This is Tom Dillon, the Lifetime Liberal. Today is Thursday, August 6, 2020. The title of this rant is What the Biden Administration Will Do. Let's just call this Part 1, Healthcare. So there's a lot of things that are going to have to happen when the Biden administration comes in. Hopefully it will come in. Let's just start with healthcare. Let's at first acknowledge that this guy currently in there is not doing anything. And even that of him not doing anything is reason enough alone just to get rid of him. But Biden's going to come in, a lot of stuff they got to do. A lot of it will take time. We have to be patient. We have to look and act aggressively. But let's just talk about the things that have to be done and we need to work at right away. Number one, Biden's got to take over the whole COVID-19 thing, and he has to cover all testing, tracing, and treatment of COVID-19. And if that means we have to rescind the tax cuts of 2018 to the extremely wealthy and to big corporations, then so be it. This has to be something that we all have to be involved in. And of course, Biden needs to look at how we're going to basically overhaul the entire healthcare system, and whether it be starting just with increasing the Affordable Care Act, Obamacare, increasing or strengthening it, or whether we go to some other types of things. It has to start, and we have to look at changing every aspect of it that we can. And remember, the Affordable Care Act was a compromise with Big Pharma and the medical device companies and the hospital systems, etc. And I'm all for people making money. I'm all for wealth accumulation, but we can't have the astronomical costs that is they're going up increasingly with healthcare. And the other thing is we need to make sure that all of the things that are part of Obamacare are still in there, and especially that all pre-existing conditions must be in there. That we have to cover all pre-existing conditions. We have to be inclusive for everyone, and other things like being on your parents' policies till 26, etc. All of that. But the biggest thing that we need to get rid of, even if we can't get to some of the highest aspirational aspects of healthcare, is we have to take healthcare, we have to untie it from jobs. Because remember, this healthcare with jobs was started during World War II. It was basically passé at the end of World War II, and Truman tried to get, and I could go on for 10 minutes on this, but tried to get a universal health care system passed in, I believe it was 1948, and the Southern Democrats at that time, who are now Southern Republicans, because remember, in the South, they had a third world health care system where they had one health care system for whites and another health care system for blacks, and they didn't use that type of a term. But basically, they were not going to vote on anything that would allow any people of color to be in any white hospital in the South. So that was defeated, and we still have that hodgepodge. So we have to get rid of having our healthcare system, that healthcare is tied to jobs. And of course, all of this will take time. We can't expect it on day one. It's one of many things that we've got to do in the Biden administration. And I'm asking Joe to think big and to act aggressively.